Patients always ask, do I need an antibiotic for that? Well, the answer is not always cut and dry, especially now when it comes to this condition.
My allergies can get really bad, and a lot of the time I end up with sinusitis. My doctor usually prescribes me antibiotics, but I also heard they aren't really necessary. So what's the deal? Do I need to take antibiotics for sinus infections or not?
Well, as our resident ENT, Dr. Orden.
And that brings up such a great topic. What is sinusitis? It's an inflammation of the lining of your natural sinuses that sit in your head and neck. Only way you can make the diagnosis is one of two ways: either X-ray evidence that the lining, the mucosal lining of the sinuses is inflamed, or you actually see pus coming out from inside the sinuses. Let's talk about what causes sinusitis. We all have sinuses sitting in our face, maxillary sinus, ethmoid frontals, and we have these little openings that drain into your nose. Now, normal physiology, things should run smoothly like this from your sinuses through those natural little openings in a nice smooth fashion. And that's to be differentiated from this, where that natural opening in your sinus is slightly clogged for whatever reason. It can start with a cold, allergies. Isn't that pretty cool?
And that's when you start to sound like
That's
this.
when you start.
Pressure build up
when you start,
sinuses.
but we have found, recent studies show that most cases of sinusitis, it's a self-limiting process. So if you focus more on opening up that natural passage in your sinus and less on antibiotics, that you're probably going to get better on your own.
The same kind of goes with ear infections too. Ear infection is basically a little pocket of mucus inside the ear, and we've learned that most ear infections will get better without antibiotics after maybe a week or so. Yeah, it's painful at the time. Usually when kids will maybe just use some ear drops for the pain, some over-the-counter meds. But the question, the antibiotics, how does the antibiotic get into that pocket of pus? It oftentimes doesn't get in there. Right.
So what can you do to help prevent sinusitis, or if you do get sinusitis?
Is doing everything you can to open up that natural opening. So it's things like steam, decongestants, saline drops, saline mist, neti pot. All of those are great ways.
Controlling your allergies.
Controlling your allergies with antihistamines or decongestants. But there are going to be a few cases. Now, if you develop fever, severe sinus pain, if you feel generally sick, because sinus disease can literally make you sick, make you feel run down. You don't know what's the matter with your body, and it's related to a collection that has become infected with bacteria.
And in rare instances, that sinus infection can actually erode through the bone and go posteriorly, causing a much more severe infection. Of course, in those cases, you're going to probably be in the hospital with IV antibiotics. But I think the one thing we can learn here is that, if your healthcare provider says, you know what, I don't think you need antibiotics here, this is what I'd recommend, that doesn't mean they're doing a bad job. It doesn't mean that if you walk out without an antibiotic prescription,
means they're doing a good job.
Right, that's exactly true. Except sometimes antibiotics are necessary, but not always. Probiotic, you like those.
Oh, yeah.
Prebiotic, you like those.